Hi, today let's learn about axillary nerve. Let's learn in detail about the course of axillary nerve, muscles applied by it, and applied aspect. So before moving on to it, I'd like to give a brief idea about what is axillary nerve and from where it comes. Okay, so axillary nerve comes from the posterior cord of brachial plexus, and its root value C5 and C6. Okay, and it is a mixed nerve in the sense it has both sensory and motor component. Okay, so now let's look after the course of axillary nerve. So before moving on to the course of axillary nerve, I would like to draw the boundaries of quadrangular space through which the axillary nerve passes. Okay, so let's consider this as the teres minor, and this as teres major, and this as long head of triceps, and this as the humerus. Okay, so this is your quadrangular space. Okay, so here your axillary nerve passes through this triangle, and it winds around the surgical neck of humerus. Okay, axillary nerve pass through the quadrangular space. So what were the boundaries of quadrangular space is it's superiorly bounded by teres minor and inferiorly by teres major, and towards medially by long head of triceps and laterally by neck of humerus. So this is the boundaries of quadrangular space, and this axillary nerve goes through the quadrangular space and gets winds in the surgical neck of humerus, and then it goes down and splits into anterior and posterior part to supply the muscles. So let's see what were the muscles which is supplied by the anterior and posterior part. So this anterior part supplies deltoid, and the posterior part supplies teres minor. Okay, I have also told you apart from the motor component, it has the sensory component. So it gives lateral cutaneous nerve of arm. So the posterior aspect of axillary nerve gives lateral cutaneous nerve of arm. Okay, so these were the muscles which is supplied by the axillary nerve. Now let's look at the applied aspects of axillary nerve. So I have told you axillary nerve this is humerus, and axillary nerve which passes through the quadrangular space and winds in the surgical neck of humerus. So if there is some fracture happening to surgical neck of humerus, then this axillary nerve will get there will be an injury to axillary nerve. And then if there is shoulder dislocation, then there is a chance of axillary nerve injury. And in addition to that, when we get a IM injection, there is a chance our axillary nerve goes axillary nerve is injured, and then it is a condition called regimental badge anesthesia, where the upper aspect of arm there is loss of sensation to the upper aspect of arm. Okay, now let's look at the applied aspects of axillary nerve. And this is humerus, and I have told you it passes through the quadrangular space and comes and winds around the neck of the humerus. So something if there is any fracture to the surgical neck of humerus, or if there is a shoulder dislocation, then this axillary nerve gets injured. Also, in addition to that, there is a condition called regimental badge anesthesia, where during IM injection, if the axillary nerve gets injured, then there will be loss of sensation to the arm. Okay, lateral aspect of upper arm. which results in anesthesia. Okay, that's why the name is regimental bowel anesthesia. Thank you. Let's see you on other videos. If you have any doubts regarding this topic or any other topics, if you're interested in, please comment me. I'll try to post as soon as possible. Thank you.